Hi everyone, thank you for tuning in to our short introductory video. We are happy to be welcoming a new member to our ED team. Laura Biskey will be joining our department in December in the role of physician assistant. I'll now let Laura introduce herself as well as the role of physician assistant in the emergency department.
Hello everyone, my name is Laura and I'm a physician assistant. I wanted to start by sharing with you one of the most spectacular views I have ever seen. This was taken in Iceland, standing on the black beach in the southernmost village of Vik. The landscape of Iceland is absolutely breathtaking. Back to our beautiful country of Canada, and specifically North Bay, I am very excited to be the fourth PA to join North Bay Regional Health Centre. You may know there are already 3 PAs at the hospital working in the internal medicine and critical care group. I will be the first PA to join the emergency department. Some personal background. I studied biology and medical science at Western University. I then moved on to the University of Toronto for a Master of Science, and I just graduated from the PA program. When I'm not studying, I might be on the golf course or taking in a Broadway show, but the other face I wear most often is probably this one. That's me. I was 17 when I joined the Canadian Armed Forces Reserves, and this was my first intentional exposure to a career in healthcare. Since 2007, I've worked in a variety of settings and healthcare teams, providing clinical and pre-hospital primary care to military personnel. My military training led to other working opportunities in the Greater Toronto Area. I've worked in inpatient general internal medicine and respirology, in laboratory and clinical assistant roles, performing anything from phlebotomy to spirometry and basic ultrasound. This brings me to what a PA is and how we fit into the ED. I can't take credit for this image, but I would elaborate so that it reads, physician assistants are trusted healthcare providers who treat, diagnose, and prescribe in collaboration with physicians and allied health. Think of PAs as physician extenders. We work in any setting and practice medicine under the supervision of doctors, according to their scope of practice and medical directives. PAs are trained as generalists with room for on-the-job training to increase scope of practice. So, in the emergency department, a PA can assess and manage patients similar to physicians. PAs perform histories and physical exams, order and interpret investigations, formulate treatment plans, referrals, and discharge. We can also perform minor procedures, anything from splinting and casting to suturing and IND. The benefits of integrating PAs into the ED include improved patient flow and access to care, reduced wait times, and less physician burnout. PAs work in cooperation with NPs, often together in teams to cover the ED during peak hours. So that's it. I would love to answer any questions you have about PAs or my role. I have always wanted to work in Northern Ontario, and my favorite placements as a student were in the northern communities like Timmins and Sault Ste. Marie. I have heard only great things about North Bay and the hospital team. So until then, I really look forward to working with all of you and learning from you.
Thanks for the great introduction, Laura. As of December, Laura will begin her training period in our department. She will be working with either the 9 to 5 or 2 to 11 physician. Laura will have a designated computer on the acute side next to the whiteboard. As of right now, we do not have any emergency department medical directives in place. Laura and the physician she will be working with will discuss orders, plans, and management for every patient. Laura is a dependent practitioner, and all her patient encounters are the responsibility of the supervising physician. When an order is written on the chart by Laura, it means that she has discussed the case with her supervising physician, and that order can be processed as usual. As of right now, nurses are not able to take a verbal order from Laura without having the order signed by the physician on the chart. If you have any concerns or need clarification on patient or orders, then you should consult Laura's supervising physician. That concludes our introductory video. As with any new changes and initiatives, there will be times of growth and learning. Please feel free to email me any questions, suggestions, or concerns.